Hi guys, today I want to talk to you about issues with your jaw. Now there's many people who do get clicking or pain, or they might be grinders, and they may or may not realize that the function of their jaw is intricately related to their upper neck. It also is controlled and influenced by what happens with our posture, particularly if we have a forward posture and there's a lot of tension through the front of the neck. So my little friend here, Freddie, I'm just showing you the action of his opening and closing, and it doesn't quite do it justice, because what is normal for our jaw is that we should be able to get 3 fingers in our jaw opening like that. So that's a good test to check if you've got full jaw opening or if there's some level of restriction. The other thing you want to think about is our jaw is a joint that is supposed to move symmetrically, meaning both sides do exactly the same thing at the same time. And the jaw itself is one that has a rolling mechanism. There's a little disc inside it, and then it is supposed to slide forward, which gives us that nice wide jaw opening. No, it's not very attractive. But if it's something that you have problems with, you realize that you can actually talk to me as a chiropractor. There's a whole set of skills that we have that address this issue and look at some of the contributing factors. So if I can be of assistance, please reach out and I can teach you some more about it and see what techniques I've got that might be able to provide you with some relief. Now, one of the other features I'd like you to consider about jaw-related issues is that people may not realize how much stress plays a part. Now, our body will respond to stress. Our brain gets signaling that there's a stressor, and then our brain will instigate a response. And for some people, it's a clenching of the teeth. It doesn't always happen during the daylight hours. It can often happen at nighttime when your body is and your brain is actually processing things of the day or the things that are ticking over in the back of your brain, and you can get a clenching stress response. So we can experience that from a symptom perspective in terms of actual pain in and around the jaw, pain when we are eating or yawning or doing open mouth type of things. We can also experience it as headaches and tension, particularly in the back of the neck. Our upper cervical spine, so occiput C1, C2, that upper cervical complex, that mechanics, and if there's any subsequent irritation of the nerves there, that directly influences the muscles that coordinate movement as well. So upper neck instability, upper neck restriction can adversely affect that smooth movement of the jaw. So just know that you may not realize or consciously be stressed, but your body can still express stress as clenching in the jaw. It might be worthwhile checking with your dentist. They will sometimes see if there's a pattern of wear. Some dentists might suggest that there's a guard that you wear, and while that is possible to protect the teeth, it may not stop that mechanism of response that's going on. So from my perspective as a chiropractor, we do want to look at, is there a level of dysfunction of the joint? What is influencing it? What other tissues or structures are also implicated? And go through a process of working to try and create release and change, so that ultimately we're trying to reduce that pattern and reduce that level of symptomatology as well. Okay, other thoughts? I hope you find that useful.